Hello and welcome everyone. My name is Dr. Abid. Today we're going to answer some most common questions about heart attack. As this is a very stressful and life-changing event, a lot of patients will have many questions in their mind. So we're going to spend the next few minutes to answer some most common questions. The first one is, what are the chances of a second heart attack? According to a study that is published in Journal of American College of Cardiology, there is a 12% increase risk at 1 year, 17% at 2 years, and 26% at 5 years. It shows that it is very highly likely that the patient will suffer from a second myocardial infarction within the next 5 years. But it doesn't mean that the risk cannot be reduced. Which brings us to the next question. What can I do to lessen my risk of second heart attack? So the first one and the most important is to stick to the medication regimen that has been given to the patient by the doctor. Some of these medications are aspirin, statin, and beta blockers. The second is smoking cessation. There are a lot of studies show that smoking cessation after an acute myocardial infarction increases survival in patients. So it's very important. The third is changing diet. So making certain healthy lifestyle changes like following a Mediterranean diet, which consists of legumes, fruits, and more vegetables. It also consists of unsaturated or polyunsaturated fatty acids. Avoiding red and processed meat, avoiding processed sugar, will make your heart more healthy. Number 4 is mild physical activity, and you should definitely talk with your doctor as when should you be active after the myocardial infarction and how much activity is needed for you. Even a walk for 20 minutes around your house is super important for your health. The fifth is management of comorbidities. So this means that those patients who have a high blood pressure, known as hypertension or diabetes, they should control their hypertension and diabetes either with the medication or changing their diet. So by controlling these conditions will actually reduce the risk of a second myocardial infarction. Let's come to the next question. What caused my heart attack? The most common cause of heart attack is atherosclerosis. Atherosclerosis means simply hardening of blood vessels. So it's a process in which there is deposition of the fatty acids inside the blood vessel wall, as we can see here. So this slowly building up the fatty materials inside the blood vessel wall can lead to narrowing down of the blood vessel, which can affect the organ that is supplied by this blood vessel, and which leads to infarction. In this case, a myocardial infarction. There are certain risk factors for atherosclerosis. So those patients who have hypertension, who are diabetic, and who have a high cholesterol or hyperlipidemia are prone to the process of atherosclerosis. As long as they can maintain their blood pressure within the normal range, or they can control their blood sugar, or they can actually treat their high hyperlipidemia, can actually decrease the risk of atherosclerosis. But those who have these conditions, they are prone to the risk of atherosclerosis. There are certainly other causes of heart attack, which we will not go into the detail. And other causes are decreased blood pressure, trauma, infection, and many more. And certain bad lifestyle choices can also cause myocardial infarction, such as sedentary lifestyle, and poor diet. So these are some of the risk factor and some of the condition that can lead to heart attack. So most patients ask if they should go to a rehab or not. Cardiac rehabilitation program is a supervised exercise program in which the patients do certain type of exercises and their heart is being monitored, as we can see in this picture. There are three components of cardiac rehabilitation program. First one is definitely exercise. The patients do certain body movements which are heart healthy. The other is reduction of the risk factor. So patient is educated on the risk factors of myocardial infarction by knowing what caused their heart attack, and by reduction and the risk factor actually reduces a recurrence of MI, and also it leads to a reduction in their stress level, because by going to the cardiac rehabilitation program, when the patients see a lot of other patients who suffer from the same condition, they think that they are not alone in this. So there is a considerable reduction in their stress level, and they can lead a healthier and happier lifestyle. So studies show that there is a 20 to 30% of reduction in mortality rate in those patients who go to a cardiac rehabilitation program compared to those who don't go. But unfortunately, only 25% of the eligible patients in the US participate in the cardiac rehabilitation program. We should spread awareness about the cardiac rehab, as it is very important for the heart and also for the patients in terms of reduction and their recurrence of the myocardial infarction. Alright, so the last question, how should I keep my heart healthy? So the first one is heart healthy diet. By consuming a heart healthy diet, which means low level of sodium, decreased consumption of processed meat and carbs, and also following a Mediterranean diet, and also following a Mediterranean diet is very important for the heart. It's considered a heart healthy diet. The next is smoking cessation. Smoking cessation is very important as it reduces chances of a second heart attack or recurrent heart attack, and also decreases the risk of atherosclerosis. It decreases the damage to the cardiac arteries and also automatically reduce the risk of myocardial infarction. And the other is physical activity. Try to avoid pushing, pulling, or weightlifting after myocardial infarction. Definitely talk with your doctor how much activity you need and for how long do you need it. And also a mild to moderate walk is very important here. Alright, that's it guys. Thank you so much for watching, and if you guys have any other question, let me know in the comment. Thank you.